Multiple sclerosis, or what is known as MS, is a neurologic condition which is thought to be a result of inflammation within the brain or spinal cord. It has a diverse array of symptoms that can be present, and those can be divided into neurologic, things such as sensory problems, numbness, or pain, or they can be motor in nature, weakness, spasms, things of that nature. Additionally, patients with multiple sclerosis also are known to have a condition known as autonomic dysfunction. This has its own unique set of symptoms, and is probably best to separate the two into the neurologic and the autonomic in nature. The autonomic symptoms include things such as fatigue, cognitive impairment, thermal dysregulation, urinary symptoms such as urgency, frequency, or hesitancy, difficulties with digestion, including diarrhea or constipation, problems with sleep, where the sleep cycle is interrupted or the quality of the sleep is poor, may also occur with the autonomic dysfunction. These are best separated from the neurologic symptoms, which I mentioned earlier are primarily sensory or motor in nature. In many people's minds, they think of someone with multiple sclerosis confined to a wheelchair or walking with a cane. However, autonomic dysfunction is present in the majority of patients with multiple sclerosis, and in fact it can be the predominant symptoms. For example, fatigue can be debilitating and be the predominant issue that is impairing someone's quality of life when they have multiple sclerosis. Alternatively, cognitive impairment can be so severe that that is the major determinant of the patient's quality of life, and is in fact related to the autonomic dysfunction aspect of the disease. TVAM is a new procedure used to treat autonomic dysfunction, or what is known as dysautonomia. It involves placing a catheter inside a vein that has a special balloon at the end. By inflating the balloon inside the vein, we're able to stimulate the autonomic nerve fibers and improve the function of the autonomic nervous system. This results in a reduction in patients' symptoms related to dysautonomia. TVAM is a procedure that is based upon the principles derived from a therapeutic option for hypertension known as renal denervation. Renal denervation involves placing a balloon catheter into the artery to the kidney known as the renal artery. It allows the delivery of energy through the blood vessel to the nerves that travel alongside it, which is known as the afferent autonomic nerve. With the dysautonomia treatment known as TVAM, we are using the similar principle by placing a balloon catheter inside the central veins, and the target is the baroreceptors, a similar afferent autonomic nerve fiber that we stimulate via transvascular energy delivery for patients with dysautonomia. The TVAM procedure is a treatment for dysautonomia, and while it does not have a direct effect upon MS itself, it does improve the function of the autonomic nervous system. MS is thought to be a disease of inflammation of the central nervous system. The level of inflammation in the body is directly influenced by the autonomic dysfunction. By improving autonomic function, we lower inflammation, and a secondary impact upon the disease of MS itself may be present with this treatment. The most common questions that I encounter related to the TVAM procedure are, how likely is this to work for me, and how long will that effect last? We've recently reviewed a series of patients in preparation of a publication in a medical journal, and from that we've learned that the majority of patients, in other words over 90% of patients, will see improvements in their autonomic symptoms. In particular, the symptoms of fatigue or one's energy level, cognitive impairment or what is known as brain fog, and thermal regulation are seen to respond with high frequency. Additionally, patients will have a response in organs that involve cycles of the body. So for example, the digestive system, the urinary system, or the sleep cycle may all be affected with autonomic dysfunction, and we see these things improve following treatment. The response initially occurs immediately. In other words, within minutes, patients' physiologic function is improved, and we measure that with tests performed at the center, in addition to patients also experiencing these things from a subjective nature. The effect may be short-lived in a minority of patients, and what we have seen over the last couple of years is that 20% of patients will have the symptomatic relief disappear by 2 months' time. However, we have studied a population of patients of approximately 400 in number that at 6 months have continued improvements or stability. Additionally, we've been doing this procedure for over 3 years, and we have patients now that have maintained their symptomatic benefits that entire time.